Hello, my name is Emma Paulino. I'm a community pharmacist at Nuno Álvares Pharmacy and currently president of the Portuguese National Association of Pharmacies, INF. Welcome to this FIP CPD Bite on the use of heat therapy for the management of musculoskeletal pain. Musculoskeletal pain refers to acute or chronic pain affecting bones, muscles, ligaments, tendons, and nerves, and managing chronic musculoskeletal pain is particularly challenging due to its multifactorial nature, necessitating a collaborative model of care among different healthcare professionals, including pharmacists, to achieve better health outcomes. Therefore, this video will provide a summary of FIP's guidance on how pharmacists can manage musculoskeletal pain with a focus on heat therapy with or without pharmacological treatments to alleviate symptoms. Information gathering and patient assessment are critical first steps in the management of adult musculoskeletal pain in the community pharmacy setting. By gathering comprehensive information, pharmacists can make informed decisions and refer patients for further medical assessment when necessary. To address time constraints faced by community pharmacists, a structured initial assessment, detailed assessment, and comprehensive assessment can be used to allow flexibility in gathering essential information about the patient's symptoms. Additionally, when assessing the patient's history, pharmacists should consider the several key factors displayed on the right to develop an effective treatment plan. Where accessible, the use of a private room also allows the pharmacist to perform any necessary physical examinations with greater ease and respect for the patient's privacy, as patients' religion and beliefs may affect their comfort level in discussing or revealing areas of their body where they experience pain. Pharmacists must understand and respect patients' religious and cultural beliefs to build trust and ensure effective communication. Recognizing critical signs early on ensures pharmacists make appropriate referrals to medical practitioners when necessary, avoiding unnecessary treatment or assessments. By addressing potential red flags from the beginning, pharmacists can prioritize patient safety and ensure timely interventions from other healthcare providers when required. A lack of response to initial pain treatment, severe or persistent pain, and a history of serious conditions such as cancer, osteoporosis, or inflammatory arthritis are some key red flags that should prompt immediate referral, as they require specialized care beyond the provisions of a community pharmacy. To streamline the assessment process, pharmacists should consider red flags at the beginning of consultations. This ensures that any potential issues requiring medical referral are identified before initiating any treatment plans. By taking this approach, pharmacists can confidently manage the treatment of patients without overlooking critical warning signs that may require immediate intervention from other healthcare professionals. Low back pain, neck pain, and osteoarthritis are among the most common forms of musculoskeletal pain globally, making them key areas of focus on this slide, and the guidance as well. By understanding when and how to effectively integrate heat therapy with pharmacological treatments, community pharmacists can offer enhanced pain management strategies, providing patients with a comprehensive, multimodal approach to alleviating musculoskeletal pain. Heat therapy is particularly effective for chronic musculoskeletal conditions, such as osteoarthritis or chronic back pain. Pharmacists should guide patients that heat therapy works by causing vasodilation increasing blood flow and extensibility. Patients should be advised to use warm, not too hot, heat packs for 15 to 30 minutes to avoid burns. Special care must be taken when advising patients with diabetes or skin sensitivity issues, as they may have diminished sensation, making them more susceptible to burns. Instruct patients to use a cloth or a towel as a protective barrier between heat packs and their skin to prevent irritation and ensure that therapy remains safe and effective. Cold therapy is important in managing acute injuries and inflammation, such as sprains and strains. Pharmacists should guide patients that cold therapy works by reducing inflammation, swelling, and limiting blood flow. Patients should be advised to use cold packs for short periods, typically 15 to 20 minutes, with breaks in between to allow the skin to return to normal temperature. This prevents frostbite or skin damage. Instruct patients to use a cloth or towel to act as a protective barrier between cold packs and the skin to ensure the safety and effectiveness of the therapy. Pharmacists need to advise patients to avoid heat or cold therapy after using topical medications such as NSAIDs or capsaicin, as this can increase the absorption rate, resulting in skin irritation and burns. Topical medications should be applied 2 to 4 times per day with adequate spacing between heat and cold therapy sessions. It ensures safe and effective pain management while preventing complications. Pharmacists should educate and advise patients about the potential side effects and safety measures of heat and cold therapy. Heat therapy, especially when applied at high temperatures, can pose a risk of burns or skin ulceration. Pharmacists should stress the importance of moderating the temperature and using protective barriers like towels to prevent skin injuries. Similarly, cold therapy, while beneficial for acute inflammation, carries the risk of cold-induced injuries such as frostbite or superficial nerve damage if applied inappropriately. In both cases, providing clear guidance on application techniques will help patients avoid unnecessary complications. When recommending topical treatments alongside thermal therapy, pharmacists should guide patients on common side effects such as skin irritation or allergic reactions. Patients should be advised to discontinue use and consult their pharmacist or a general practitioner if severe reactions occur. It is also essential to avoid applying heat or cold immediately after using topical medications, as this can increase absorption and lead to heightened irritation or burns. Additionally, pharmacists should guide patients on potential interactions between medications or supplements they might be taking. Patients should always consult a healthcare provider before starting new medications, vitamins, or herbal supplements during their treatment plan. Pharmacists should inform patients to adhere to the treatment plan for a recommended period of 3 to 7 days. This time frame allows patients to experience some level of relief or symptom improvement, especially for non-chronic conditions. However, if the treatment appears ineffective or provides inadequate relief after this period, pharmacists should advise patients to consult a medical practitioner for further evaluation. This guidance ensures that more serious conditions, which may require a medical diagnosis, are not overlooked. It was emphasized that while many patients may experience intermittent or chronic pain, a lack of improvement within this window serves as a red flag, indicating the need for medical intervention. Pharmacists should be vigilant in advising patients to stop treatment and seek immediate attention if there are any signs of worsening symptoms or unexpected adverse reactions. These adverse events may include sudden exacerbation of pain, new symptoms that were not initially present, or reactions to any of the treatments being administered. By reinforcing these precautions, pharmacists play a crucial role in ensuring patient safety and preventing the progression of potentially serious conditions. Some key takeaways are: the role of community pharmacists in managing musculoskeletal pain is vital to improved patient outcomes. Community pharmacists are ideally placed to manage musculoskeletal pain through education and lifestyle recommendations, as well as treatment advice, guiding both pharmacological and non-pharmacological options. Pharmacological and non-pharmacological treatments, including heat therapy, play a key role in the management of musculoskeletal pain. And through careful patient assessment, informed recommendations, and appropriate use of pharmacological and non-pharmacological options, pharmacists can improve pain management in a holistic, patient-centered way. Thank you for watching this CPD Bite summarizing FIP's guidance on how pharmacists can manage musculoskeletal pain, with a focus on heat therapy with or without pharmacological treatments to alleviate symptoms. Kindly scan the QR code to access this publication. We hope this resource equips you with the knowledge and tools to employ a multimodal approach to the management of musculoskeletal pain and holistically individualize patient care.